Well, we will move on then. Next we have Michael Graham, who is the Senior Vice President of Government and Public Affairs at the American Dental Association. Michael has 38 years of experience in government affairs in federal and state legislative arenas, having worked for 2 Maryland governors and a U.S. Senator. Right.
Well, good afternoon, everybody. I've been with the ADA for 22 years. And during that time, our issues have shifted considerably, so much so that the access to care issue is the #1 issue for the American Dental Association and for our dentists. And CHIP is a big part of that access to care equation. I'll tell you that in 2009, when Congress was debating the Affordable Care Act, I had an opportunity to have a conversation with a very influential U.S. Senator, and I was talking about the importance of dental care being included in the ACA, and he stopped me and he said, well, you know, Mike, we're really focused on health care. And I said, well, Senator, the last time I checked, the mouth was still part of the body, so my flippant response to him got me, okay, let me put it a different way. We're not focused on dental care. So unfortunately, there were aspects of the ACA where we wanted to have dental care included that were not included. CHIP, however, has made some changes that have really enhanced the benefit, and let me just go over some of that as well as some important facts. For example, some of you may not know that tooth decay is the most common chronic disease among children and teens, and that by the age of 5, 1 in 4 kids will have some type of decay, and that by the time they get to their teenage years, it's closer to 1 in 2. Children with poor oral health tend to miss school a lot more, obviously, than kids without poor oral health, and in fact, they miss school in significant numbers. And interestingly, it's preventable. The vast majority of dental disease is preventable with good education and prevention techniques. Cost is a barrier, we know that. And again, that's where CHIP comes in. Untreated dental disease will have a significant impact on the economy, and I'll give you one example, and that's emergency room visits. Probably don't think about that too much, but over the last 15 years, we've seen the incidence of ER visits go up, specifically for oral health concerns. Now, around the year 2012, we start to see those numbers go down, and we think it's largely to some of the expansion in dental care, Medicaid programs, and CHIP. To give you a real good number, the cost of a visit to the ER for a dental issue is about $860. So when someone goes into the ER and they have some type of oral health crisis, the average cost is $860. How much does it cost? What's the average cost to go see a dentist? About $240. That's a pretty significant savings. We all know that the CHIP program covers millions of kids, about 9 million, and thankfully dental is a big part of that. They're covered, they get dental coverage through CHIP. In 2009, when CHIPRA was passed, it actually solidified that there was a dental benefit in CHIP. Prior to the passage of CHIPRA, it was really left up to the states, and they were not required to provide dental services. The great thing about CHIP is it actually functions very well with Medicaid, and we've seen over the years that utilization with CHIP and Medicaid go up as it refers to oral health usage, and that's terrific. CHIP reauthorization is a high priority for the ADA, and we've been pretty vocal about that. We believe that a delay or significant change to CHIP, as it's written right now, will leave many families with limited opportunities, and it end up being more costly. Bottom line is that dental coverage is important to comprehensive coverage, and that without that coverage, dental coverage in CHIP, it's going to have a significant impact on the lives and the prospects of those children in school and in their employment life later on. Thank you.